Nancy, when you were diagnosed with lung cancer, you've talked earlier in the segment about how you don't actually think about it and that life has continued pretty much as normal, and I hope you're still golfing.
I am.
And how has this impacted on your life, having this diagnosis, both physically and emotionally?
I think perhaps it has bothered my son more than it has bothered me, because he realizes that whatever care I'm going to need is going to fall on him. And not that he isn't willing to do it, but it makes him very sad. For me, as I said, I don't think about it. And I think that's my salvation, really. I go on about my life as though I didn't have it. And until I have an appointment with Dr. Horn, I really don't think about it.
And
I really don't.
And as a patient, you're being managed by experts in the field.
Absolutely.
With Dr. Horn, and I'm sure you've met many other members of Dr. Horn's team. Do you think, as a profession, that we put enough emphasis on the caregiver, your son, family members?
Yes, absolutely. Absolutely. I could not ask for any better care than I am getting. And that includes every single doctor there at Vanderbilt. They are, as I told Dr. Horn the other day, I might even have lung cancer to get care by her. But they really are exceptionally kind. They make you feel as though they care right down to the nth degree about how you are.
And you're obviously...
That's remarkable.
And you're obviously very fit and active, you're playing golf. How much does the actual follow-up, the surveillance, going to doctor's appointments, having scans, how much has that interfered with everything else that's going on?
Doesn't bother me. This is just something you do. I go to the grocery store, I cook dinner, I do the laundry, I do everything that I want to do. Sometimes I use it as an excuse if I don't want to do something. It's convenient. But I don't let it limit me in any way. It may come a day that it will, but so far it hasn't.
Although she was very clear when we first met that chemo needed to work around her golf days on Wednesdays. So that was the one stipulation, that nothing interferes with golf.
Dr. Horn, we're here talking about lung cancer, and Nancy's a fantastic poster child for what she's dealt with emotionally with this diagnosis and the treatment, and it's fantastic that she's been able to go through what sounds like fairly aggressive treatment with chemo. I mean, how realistic is Nancy's situation as a sort of representation for other patients? Is she a superhero having gone through this? Or for patients like Nancy who have this diagnosis, do most patients tolerate the treatments as well as Nancy has done and been able to continue with the activities that are important to them?
So it's definitely variable, and when we sit down and talk to patients for the first time, especially patients with stage 4 disease, I'm very specific that, you know, the goal of the treatment is to improve your quality of life and improve your symptoms, as well as extending survival. And I think quality of life and symptom management are the most important part there. So when we start treatment, I also tell patients, you know, drugs are given based on FDA-approved doses. And if you're not tolerating something, we can reduce doses, we can modify doses. We didn't have to do that with chemo, but on the clinical trial, we reduced doses of medications. We stopped some of the medications. And each time we do treatment, we just have to see how people are feeling. But there are many things that we can do to help people in terms of managing their symptoms today, medications that we didn't have even when I first started training.